closing the door over there. We each have our own practice. Holly owns Healing Space Collective. I own Being Human Group. We're both in Plymouth. We share space. We work in a collaborative space, but we each have our own business and our own practice. We're both small group practice owners. And we started working with psychedelics 3 years ago.
Yeah.
We both did some moonlighting at a ketamine clinic for a year and had the opportunity to learn a lot. And then did some additional training as well, and have been kind of taking the show on the road since then. Here's our objectives for our CEs. This is important, but not also that important at the same time. When you think about psychedelic assisted therapy, or when you hear that, what comes up for you? So if you want to scan, we can have it on the board then. But thoughts, feelings, images, what comes up when you think about psychedelic assisted therapy?
A minute or two to do that.
You guys can shout things out too, since we're such a small group.
Yeah.
Here we go.
Cool.
Yeah.
Okay.
Cool.
Yeah. Okay.
What
What else?
do other people feel?
Can I go?
Yeah.
Absolutely. Yeah.
I think it's shrooms.
Yeah.
Yeah.
Yeah. Absolutely. Yes. Yeah.
Does anyone feel a little nervous about it? Like, woo. Yeah.
Okay. Yeah.
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 Yeah. Okay.
It's interesting. We ask that because sometimes people don't admit that, and then like the energy in the room as we continue on, like it gets a little heightened, and I'm like, oh, everybody. I didn't know that.
What comes to mind for me is like, how do I not get sued as well?
Yeah.
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 No,
Very
that's okay.
important.
Absolutely.
Compete for
Absolutely.
licensures.
Yes. No, that's important.
Yeah.
So, what are psychedelics? So, psychedelics that you might care about are mushrooms, psilocybin, ayahuasca, DMT, LSD, ketamine. Ketamine is not actually a psychedelic technically, it's a dissociative anesthetic, and that's mostly what we're going to talk about today because that's what's legal. MDMA or ecstasy, these are all in the psychedelic family. Psychedelics work on our serotonin receptors. Ketamine does not. So ketamine works on the glutamate receptors and increases neuroplasticity. So that's what's responsible for neuroplasticity. Serotonin can also help improve our neuroplasticity, and so all of these things can improve that for folks, which is part of the benefit, especially for people with treatment-resistant depression, trauma, and anxiety that get stuck in those really rigid thought patterns. And so increasing that plasticity, increasing that ability to flex and change is really, really helpful. But that's where therapy becomes really important in this work too, because sometimes what people will do is just go do psychedelics, which is fine, people can do what they want, everyone has autonomy. But if we're not doing the integration pieces, if we're not making good use of that new neuroplasticity, then what are we really doing? And stuff can come up for people too that can be scary sometimes. And so people will talk about having a bad trip. Oftentimes it's an unguided trip, or they took too much, or they were not in a good, safe space to do that, because it does feel very vulnerable when you're under the influence of these things. So when we think about legalities, ketamine was legalized in 2019, and we saw ketamine clinics pop up. At least here in Michigan, we saw lots of clinics pop up really quickly. It was legalized across the US for off-label use. So IV ketamine is the most effective. Most people within 24 hours of having their first IV session will have a 55 to 70% reduction in symptoms within the first 24 hours of that first dose. So it's really, really powerful. Oral ketamine and Spravato, which is nasal spray ketamine, a little less so, but still can be very helpful for folks. It does take a little bit longer to get that reduction in symptoms. Spravato is covered by insurance because it's not actually ketamine, it's synthetic ketamine that they've developed to use as a nasal spray for the treatment of depression. For it to be covered by insurance, you have to be on an SSRI, and you have to have failed 2 other SSRIs, or insurance will not pay for it. So it does increase access a little, because these treatments can be expensive, but not quite enough. Oral ketamine is also utilized through, I'm sure you know, mail order companies or seen some of these mail order companies, Mind Bloom, Journey Clinical, and people can do these things at home with a guide online or with their therapist, if you're working with one of these companies. And that can be effective for folks as well. But IV ketamine is really the most effective, and is what was researched most heavily. But it is not covered by insurance. It is out of pocket. A lot of the clinics do not have therapists on staff, so they're putting you in a room with blindfold and headphones and saying, have a good time. And people can get really dysregulated and really scared because ketamine is in charge. So other psychedelics are much more gentle, and the person is really in charge of their journey and can choose to not go in that door if they don't want to. Whereas with ketamine is going to take you to outer space.
So how I describe it as a sitter, for somebody on ketamine, I feel like I'm pulling them down. I don't want to bring them out. I do need them to let go, but I'm kind of that, like they're kind of tethered on a balloon, and I'm kind of their anchor. We're like psilocybin, it feels more like, yeah, I'm just sitting with you. I'm just holding space as you experience whatever it is that you're experiencing. So there's a different feeling when you're in it, even from like a therapist sitter point of view.
And because ketamine is a dissociative, it takes that fear and shame center away, so people can, see things more objectively or have their emotions more fully, which can be really great, but also really overwhelming. And so the preparation and integration pieces become really important, because otherwise this can just be really scary for people. And anybody with a DEA license can do ketamine therapy. So dentists can have clinics, it doesn't matter there. And that happens, at least in Southeast Michigan.
Yes.
Is that also true of any of these other, like psilocybin and a couple other ones you mentioned?
So those are not legal.
Okay.
They are decriminalized in parts of the U.S. So Colorado and Oregon, they're decriminalized, and there are clinics and people are doing these things. In parts of Michigan, they're decriminalized. Washtenaw County and Detroit, Oak Park, Harbor Woods.
Yeah.
There's these pockets where it's decriminalized, but overall, no.
And what decriminalized means is the prosecutor's office is just not going to come after you and charge you. The police might do things. Things might happen, but you're not going to actually bring a charge to you because they've decriminalized it.
Right. And there's some debate about whether decriminalization or legalization is better. Because if it's legalized, then we see, like we do with ketamine, where anybody with a DEA license can be prescribing, and then the prescribers are in control, not necessarily mental health folks. And so the same thing will happen if and when psilocybin and MDMA are legalized, because they get submitted to the FDA all the time to be legalized, and they keep trying. They will continue to try. There's a lot of advocacy for this work. But then what will it be turned into? Will it be turned into a synthetic version like ketamine with the nasal spray? Will it be turned into something that only psychiatrists have access to? We don't know. And there's not a lot of rhyme or reason to a lot of that. And so that's something that there's some debate about, and definitely something to think about. But it is important to know what's legal where you are and what's allowed. And for your clients to know that as well. Because clients seek this stuff out, and we both have clients that have gone on ayahuasca retreats and things like that, and I'm sure you guys have heard of things like that too, and just letting them know, like, you can absolutely do that stuff, but let's make sure that this is a safe space, let's make sure that this place is, like, doing things well enough, in this kind of wonky, illegal space.
One more follow-up question.
Yeah.
So is any type of ketamine, or you mentioned, oral IV, Spravato, any of that you need a prescriber, someone with a DEA license to prescribe it and administer it, potentially?
The oral ketamine, no. So those come through these mail order companies like Choose Your Horizon, Journey Clinical, and Mind Bloom.
Okay.
I think there's probably some others too, but those are the ones I'm most familiar with. And it gets mailed directly to the client. So the client engages the prescriber online, they fill out a little survey, and then it's mailed directly to their house. And then it's their responsibility to either do it with a guide or not. These services offer guides and offer therapists for an additional price. And like Choose Your Horizon, which I work with, they partner with local therapists to refer together and will not prescribe if you're not connected with a therapist. But they are the only ones that do that. The other ones are like, you can just have it at your house, cool, whatever. Which again, I have mixed feelings about. But it is typically more accessible. Something to keep in mind with oral ketamine is it can cause bladder damage if you're not hydrating well enough. Ketamine in general can cause bladder damage. And so for people who have bladder sensitivities, bladder issues, it may not be the best thing. But if you're doing IV, it's in a bag of saline and you're getting kind of flushed out while you're having your journey. And the Spravato seems to not, because it's not digested, it's not passed through your body the same way, it doesn't impact the bladder. So those are considerations as well. People with uncontrolled blood pressure should also not do ketamine because it does increase your blood pressure. And so you can have blood pressure issues, but they need to be managed because otherwise it can be unsafe. But otherwise you can be on any psych meds. They often want you to be on an SSRI while you're doing ketamine, particularly for it to be covered by insurance. And it's safe for folks who cannot otherwise come off their medication. For the psychedelics that are with the serotonin receptors, so psilocybin, MDMA, ayahuasca, where serotonin is impacted, we run the risk of serotonin syndrome, and so people cannot generally be on SSRIs and also do a journey. People do. They sure do, but they can end up really sick.
We also do a lot of, I'll do ketamine, and then I'm also going to microdose psilocybin because isn't all psychedelics good for my brain? And so having to have that conversation with clients too. A little bit more into that. Okay, so your role as a therapist. What are you here for when we're doing ketamine? And so I think it's important to know, let me talk a little bit about particularly the IV ketamine pieces is 6 sessions, and then there might be a monthly routine maintenance session after that. So in most cases, you are not sitting with somebody while they're doing ketamine and then trying to do talk therapy at the same time. So I just want to dispel that myth because I think a lot of people think that that's what's happening. Really what is happening is you are intaking the client, you're preparing them, you're building that safety and that trust, you know, talking to them about health considerations, things like that, and we're going to deep dive a little bit more into that. And then they might go to the ketamine clinic without you, you know, because it costs money to do the ketamine, and then to have to pay your therapist $150 an hour plus, that's a lot of money out of people's pocket, so they might go to the ketamine clinic, and then afterwards they're coming back to you and integrating within 1 or 2 days. And so what this could look like from a clinic standpoint is they might, like, let's say they do ketamine Tuesdays and Fridays for 3 weeks, you know, then they got their 6th session. You would probably be on that Friday ketamine piece, you would then be Monday meeting with the client and you do an integration. On that Tuesday, you would be meeting them Wednesday and Thursday. You know, and we'll talk a little bit more about that, but just to kind of give you guys a framework of like, what does this actually look like, you know, when I'm working with somebody. If you are sitting with somebody, that looks a little bit different. Again, your job is not to be a therapist, your job is really just to hold the space, help people ground, help people stay calm, and kind of working through that. But most of you, I think in this room, would probably just be intaking people and doing, you know, the integration work afterwards. And part of our job is what we do in general, right? We create safe space, we build trust, we support clients through their journeys. There's some stigma around psychedelics use, particularly sometimes from friends or families, which could be really interesting when that comes up. I had one client who, she did her first ketamine treatment. Her father drove her home, went to get her food, came back, and then lost his shit on her because he was carrying all this guilt and shame about her depression journey. And it came out in that moment. I was like, that was the worst timing, sir, worst timing. Would have been good to know that, so we could have prepped the family ahead of time. Assessment and screening, and we'll talk a little bit more about that, like when clients show up, how do you know what's going to be a good fit in what area? Health considerations, kind of what Becca talked about. We could talk a little bit more about intention settings, and Becca kind of talked a little bit about the legal stuff. So just an overview is like, what is your role in this situation? So we want to be safe, and we want our clients to be safe, right? That is our #1 job as therapists. And so I'm going to talk a little bit about set and setting and assessing, and then I'm going to pass the mic back to Becca to talk about serotonin syndrome a little bit more, because she's got a fun story to share with that also. When we're talking psychedelics, you'll hear this a lot, set and setting. Set is mindset, intention setting. We will talk about that in a bit. Talking specifically about this setting, like what is the right fit for the client and where they're going to go. Are they doing this in their house? Are they doing this, in the clinic? Or are they doing it with you in your office? And kind of thinking a little bit about what would be the best for a person. So if it's, you got your kid at home and there's a dog in the house and your husband's upstairs, your partner's upstairs doing work, like that might not be a great setting, for somebody to do this. If they're going to a clinic, can we prepare them to know that like people might not be sitting with you in that room? Is there someone who could be supportive that can come with you, and what could that look like? And then the therapist consider kind of like what that would look like coming to the office, all of those pieces. That with ketamine, that one is not. I feel like we don't do a lot of therapists that consider with ketamine as much, a little bit, but
I do some.
yeah. Assessing clients' openness and expectations around the experience. We'll talk a lot more about expectations and take, but also just their openness. Like, what are they expecting to come out of this? Are they able to let go? Are they able to release? And be able to allow the ketamine to do the work that it does. And then kind of what lifestyles do they have? Do they have social supports in their life? Do they have things that they can focus on between sessions? Do they have a therapist? And their own ability to regulate their nervous system. So can they kind of stay calm, grounded, let go, all of those pieces? Because this can sometimes be anxiety producing for some folks. We do find for folks with anxiety, it's very a body experience for them, ketamine can be. And so there can be a lot more anxious feelings about that, and just prepping clients for that. And we'll get into a little bit more of the intake and stuff.
Ketamine is definitely not for clients who struggle with letting go of control. Because again, ketamine is in charge. The client is not in charge. And so if it's a client that feels really unsafe relinquishing control, ketamine is not going to be the best choice for them. Even if it could benefit them, we got to do some work around that first to get them better prepared for that. So serotonin syndrome. Clients are often unfamiliar with what this is. Client therapists are also unfamiliar with what this is. It's basically your brain dumping all of the serotonin all at once and then not making it for a couple of weeks at all. And so you feel really, really terrible and sick. Very, very worst case, very, very rare, you can die. More often than not, people just feel very hungover for a couple weeks and like just yucky. I had a client who I did a journey with. He was great, everything was great. He went back home and 6 months later was like, I think I want to do that again, but I don't want to pay Becca again, and so I'm going to do it myself, and I'm going to get some stuff from, Joe down the street. And he took a lot from Joe down the street that he didn't know what it was. We did not consult. He didn't tell me he was doing this. I had no idea. And then he's texting me, I'm in the hospital. Why are you in the hospital? Well, because he had serotonin syndrome and made himself really sick. So then we talked a lot about why we don't do that. And why, you could have at least talked to me about it. I could have better guided you how to do this. And not from Joe down the street, I could have given you some resources. We could have talked about this. But that stuff happens. If you have clients who struggle with serotonin syndrome when they take SSRIs, that doesn't necessarily discount them from this stuff, because sometimes synthetic SSRIs are different from things like microdosing and psychedelics. So just bear that in mind as well, but it is something to absolutely be cautious about and be worried of, and to, less is more. Less is always more. And letting clients know that too, because I think sometimes clients think more is more, and it's going to be magic, and there's no magic. We do still have to do the things And we do still have to, do the work and do the preparation and, do the work after whatever came up and make some sense of that. And sometimes even let things go that like, we don't maybe need to make sense of that. Maybe that doesn't matter. Just because we saw some animal or something or whatever, like it doesn't have to have meaning. It doesn't have to be anything. Sometimes those things have meaning for people and sometimes they don't. And so sometimes it's also a process of like just letting go in general. Back to you. Yes.
Okay, so intake and preparation. So a client calls you, says, hey, I'm doing ketamine or planning on doing ketamine. I would like to meet with you as a therapist. How do you set that up? So to really have them come in and do several sessions before they go into ketamine, just to get a sense of your client. Again, we're building safety, we're building rapport at this point. We also really want to look at like, what are your expectations? Like Becca said, are you picturing this as like a magic pill that's going to solve everything, or do you understand like you do need to actually do the work afterwards, with this? What's your fear? Because everybody has fear and nervousness about this, and so really kind of poking at that. How do you feel about losing control and not being in control of something? A lot of people have feelings about that. And as we really kind of building, what is their expectations about that? What do they expect the outcome to be? Kind of preparing them the day of and the day after. The day before can be really important for ketamine too, just because it can be that time to really take care of yourself, ground, do some nervous system stuff. The day of, having people eat, but maybe you eat a little bit, because for ketamine, a lot of folks feel nauseous sometimes when they're doing it. And so just talking with them about that, like, do you need to take some anti-nausea?
Dramamine.
Thank you.
Yeah, and some clinics will provide, the nausea medication. I know, it's not true.
It's a hard word today. And so that can be really helpful just to talk with them about that. And, what their expectations of their experience. Because some people have that Michael Pollan, like, oh, it's going to be like shrooms. I have control of the situation. I'm just going to see, like, the tree's going to be amazing and, like, everything's going to be great. You're in the stars. You're seeing lines that may or may not make sense to you. Like, it's a different experience for everybody. And I think that's the big piece to talk to people about, too, is, like, everyone's experience is different, and yours might be not what you heard, in magazines or books or things like that. And then the day after, how I like to prepare people is to really let them know, like, hold that experience to yourself. This is not something that I would like be telling the person driving you home from your ketamine experience, because they're not going to understand. And so really kind of holding that close to so you can make sense of it, We find also a lot of people, you go home, you might want to eat something, and then you're going to go to bed. So really this is not, we're going to take ketamine and then go to work right after that. A lot of people, even the day after, kind of can feel the impacts of that. And so prepping clients for that, like, what does that look like? What are you going home to? Is your house calm? Are your kids going to be all over the place? Like, do you have to go home and make dinner? Or are you going to have like a meal all ready for you? So stuff like those, like, little detail pieces can be really helpful.
And people do need a driver for
Yes.
these things. They cannot drive themselves. Even though most people are pretty sober by the time they leave, if they get pulled over, if something happened, it would be an OWI. That's not okay. We're not doing that. And so people do have to have a driver.
And when we did the ketamine clinic, we would actually have a lot of people do Ubers,
Yeah.
and that was okay. They were worthwhile, like, in their head enough to be able to do that and be fine with that. So that's always an option too. Okay, intention setting. This is so important in doing psychedelic work. This is the set. Okay, intention setting is different than goals. Goals is like, this is the thing I want to achieve in the future. And intention setting is really, what do I want right now in this moment? And so really working with clients to kind of maybe do a personal inventory of their lives, of like, what emotions you feel the most, what do you need to let go of? What would you like to experience more of? So some intentions my clients have had has been like, I want to feel more comfortable in my body. So the intention would be, I am more comfortable in my body. I need to release grief. I'm letting go of, past traumas. I'm processing past traumas. Those types of intentions is really important for this work. The other thing with ketamine is because it's multiple sessions, we're making these intentions buildable. So I had a client who, bless her soul, music is very important in psychedelic work. As I'm crafting a playlist, making a playlist that can be part of your preparation and intake. So she would sit there and she would count the songs. And so that was the whole time during her first couple sessions, and ketamine was coming, this music to just like ground herself. And so then we had to talk about like, well, maybe we could let go, you know, and be able to just not count the songs anymore. And then we turned into, oh, is your predictive thinking, your need to control everything, you know, that her thought process was like, oh, I'll do ketamine, and then after that, then I'll have to do like electric shock therapy, and then I'll have to do that, and I will never be cured of this depression. And so really being like, can we let go of your predictive thinking and just allow what happens to happen? And so that became the intention for her. The piece with plasticity also is it's the in-between sessions that is building plasticity in the brain as much as it is the experience. And so that intention setting around what do you do between sessions to build on the intentions that you created? You know, so for my client who's counting music, could we maybe do some breathwork activity? Could we do some mindfulness activity in between the ketamine sessions to kind of build that plasticity in the brain? So yeah, intentions are very important and very the piece to do during the intake. Did you want to add anything? I know you have adding face on.
Thank you. What happens particularly for men is that they may have an intention, but then ketamine really takes them through some pretty violent ego deaths sometimes. And so you also have to prepare them for that. This doesn't happen to women. This doesn't happen to trans men. This just happens to cis men. It was very interesting. I don't know the research on this. This was absolutely anecdotal from our year in the clinic. But men get drowned by demons in hell on their ketamine experiences. They get run through by swords. You have to tell them this so that they don't freak out. They have to know that in session 2 or 3, they're going to die in their journey, and it's going to be okay. Because you're not really dead. You're fine. You're in the chair. You're fine. But this happens. And at the darker and deeper and longer root of their depression, the darker and more violent their death is. And it happened to every single one of them. And the younger they are, the more they want to fight you. Then in that moment, you have to watch not get punched. And you might have to call your nurse anesthetist friend in to turn the IV off so you can ground for a few minutes. And take some deep breaths and, you know, maybe slow down a little bit. But this happens. Men need to know that. They need to know that that's a possibility at least. And that doesn't mean that it's not going to help them. It doesn't mean that they're not going to get benefit from this, but they are going to have a very rough second or third session. And that's normal, and that's okay, and that's part of the healing journey. And so how can we best support them on those in-between sessions, and how can they have their life set up in a way that they can feel that stuff safely and go home to a safe environment when they've had a really vulnerable, maybe not so great experience that day.
The flip of that is teenagers, they just jump up and they're like, okay, what's next? You're the one that was like, I'm gonna go skiing now.
Yes. It's this little tiny thing. She was 16 years old, significant depression, multiple inpatient hospitalizations. She was maybe 100 pounds soaking wet. She would pop up, I'm going skiing now. All right, girl.
The plasticity in their brain is amazing. You know, and you can see it through ketamine. So, no, and I'm glad you talked about that because I was like, do I talk about that now? Do I talk about it later? So it's important to know. And even with not being a man, there is usually a session that is really challenging for ketamine. And so really helping people work through that. And also checking your own energy because like I'm comfortable with hell and demons, that's fine. You want to go there, that's cool. Because I view it a little bit differently. And so it was interesting though, I think, to see some of our other people get really upset as therapists about what was happening to them. And I was like, no, it's just, you know, having ego death, it's okay. It's what it is. We gotta face the demons, it's what it is. And so just checking your own energy in the space, because if you meet them like, oh my God, what's happening? That can get overwhelming for the person too. Okay, integration. This is one of the most important parts about psychedelic experiences and the one that is least done. And so this is really, as therapists, this is your role. This is your place to shine, okay? So integration is taking the experience and processing and making sense of it after the fact. And I'm telling you, you're gonna have some stuff where people will be like, that blue line meant this. And you're like, okay, it won't make a lot of sense, but through talking about it, people will come to their own conclusions about it. And like Becca said, there's some things that like we don't need to make sense about that. And check your own bias again around integration in your own belief system. So I had a client who, she ran with the wolves, and I was like, oh my gosh, that's so great. We're like in community, we're doing the thing. And then later on, they were like, no, I was in the pack, but I felt completely alone. And I was like, well, damn, I'm glad I didn't say anything, you know? But we were then able to process that, like, what did that actually mean for you, you know, to be alone in that moment. And the lack of integration can really leave clients feeling disorientated, lost, confused. All those impactful moments that could really actually change their life get lost. Because over time, within like a week, 2 weeks, it starts to fade, that experience a little bit. It feels a little bit further in the distance. It doesn't quite make sense as it did in the beginning. And so it's really important to do the integration piece a couple days after their psychedelic experience to then be able to kind of pull out the different strands and things like that. And the last one I would say too is like, again, reminding them to keep that experience close. Hard for our verbal processors, okay? They want to tell everybody about what happened and, you know, play by play of it. But if they can maybe just journal about it or draw about it or listen to music, dance, whatever they need to do to process it and make sense about it, but not in this very like logical mind. Because we are working with illogic mind at this point. We're working with a different part of our brain.
So how can you do this work? In terms of billing, marketing, other business considerations, connecting with other providers. And so when we started doing this work, part of it was figuring out what are we comfortable with given what's allowed and what's not allowed. I'm a person that likes to know what the rules are, and then I'm going to decide if I'm going to follow them or not. You know, and so everyone has to know their own comfort level with that and their own, what their space is and things like that. For people doing oral ketamine, for instance, at home, like virtual sessions can be really great because they can be in their space, comfortable, set, and you can just be there as a support. You might not be even saying a lot, but just kind of being there as a support, and that means you can run just like a regular therapy session. It's not any different from a billing perspective. Insurance doesn't need to know that you sat with somebody for a ketamine session. Who cares? Okay. But I'm comfortable with that. I'm okay with saying this was just a regular therapy session. Not everyone's okay with that, and that's fine. And so just kind of thinking about those things. Marketing can definitely be a little bit tricky in terms of legalities and what people want to do. What's worked best for us has definitely been focusing on SEO and blogging. I say this is a mistake because it's not something that I offer at all, and so it's just a mistake, but we got a lot of hits on it. I wrote a blog about MDMA couples therapy because there's a ton of research on it. It's just interesting, so I wrote this blog, right? I don't say that I do this anywhere. I do not do this. I do no couples work. I get outreach at least once a week because of that blog post from people all over the country. So people are looking for this stuff. People want to do this stuff. There's a lot of research that supports doing this stuff. There's a lot of podcasts and all kinds of things, you know, that people hear, Netflix documentaries, specials, all kinds of things where people are like, oh my gosh, this would be so helpful, this would be so amazing for me or for me and my partner. But you have to know what you are comfortable offering and what you're not comfortable offering. But just know, like, people are looking for this. People are looking for help. People are looking for a different way to do things. People are looking, you know, for providers to talk with them about it and work with them about it. And even just opening the space for clients who have maybe had some experiences on their own and saying, like, we can absolutely talk about those things in here. You're not in trouble. You're not, there's no judgment. There's no nothing. You know, if you went and did an ayahuasca retreat somewhere cool, tell me about it, let's talk about it. Because I do think there's stigma and there is issues with legalities, and so people hesitate to talk about it even in their therapy sessions sometimes. So we just want to create that openness, even just to let people know you can talk about this, you can process this here, whether you're offering that service or not. And again, from a billing perspective, I'm an insurance-based practice, and so that's where I'm operating from. You have a lot more leeway if you're a cash practice, you have a lot more freedom if you're a cash practice. I do not, and so here we are. But the other piece is also connecting with other providers and letting clinics know that you exist, that there are therapists in their area that have room for these clients, because again, a lot of these ketamine clinics do not have a therapist on site.
And they want a list of people who will do integration services and are looking for therapists to do that. And so this is a great way to market yourself, to get yourself out there.
It was very surprising to me working in the ketamine clinic how many clients came in not having a therapist or not ever having a therapist, and they're just coming to do this. This is where we're starting. It was very surprising to me. Not the best choice, but people are looking for help. People feel so depleted and defeated, and so they're really looking for, you know, kind of quick fix sometimes. But unfortunately, there are no quick fixes. And so really grounding people in that, settling people in that is really important.
It does amazing things, I will say, because I had a client who, she was at, I mean, we would have lost her to suicide. And definitely treatment-resistant depression. And we were able to get her in the ketamine clinic and get her the help that she needs. And now she's doing fantastic. And is actually like a huge psychedelic advocate, which is very cute. You know, like little college students, like, this is great stuff. It's just cute to watch. Yeah.
If you're interested in learning more about psilocybin or MDMA, we do have a membership community with lots of training videos and once a month consultation, where we talk a lot about this stuff, and how to do more of that stuff. And so that's always an option. But I also want to know what questions you guys have, because we do have time for questions. I wanted to leave time for questions because I know this is often a thing people have questions about.
I was just going to ask, in terms of the integration component, what is the frequency of sessions or number of sessions going to look like pre and post getting the ketamine, you know, each dose? And is that all, like, have you ever had any issues billing that, the therapy component?
So the general rule of thumb is somebody does ketamine, a couple days later you do the integration session with them. But I would say integration takes days, weeks, and months. Like, people are pulling things out of that over a period of time, and so it can definitely take longer than that. And some people need that time. Yeah, no, that's a good question.
I've never had issue billing people twice a week, because in that ketamine piece, like when they're really like in it, I'm typically seeing them twice a week. I've never had issue billing someone twice a week.
Okay.
You do have to make sure that they have a diagnosis that warrants twice a week. Like, they can't be an adjustment disorder and you're seeing them twice a week. You know, you have to play that game. But typically, these are folks that have really severe depression or have PTSD or have OCD or something that would warrant, you know, having that twice a week therapy. Ideally, to me, we're working with clients at least a month ahead of when they're doing a ketamine session. That doesn't always happen. Ideally, that's what we're doing, so we can have good preparation and be prepared for all the things that can come up and happen, and not be so terrified when that stuff does come up, because it does, and it is scary. But that doesn't always happen.
And then, so with most of your clients, the actual ketamine session, are they typically going through insurance, and do they get qualified, or are they paying for that out of pocket and then working with you through insurance?
So it depends on what they're doing. So if they're doing Spravato, then they can get qualified through insurance. But if they're doing IV or oral, there's no insurance coverage for either of those. And IV is expensive. It's $3 to $5 grand for the series.
For the series?
Yeah, for the 6 sessions. depending on the clinic, depending on all the things. And so it's not accessible for a lot of people. Oral ketamine, you can help me out, Cameron, it was like
About 1,100.
1,100 for 12 doses.
Yeah, and you change the dose. Like,
Yeah, so
at the
they
beginning.
adjust you. Yeah. And Spravato is the only one that can be covered by insurance. That's usually done over 15 to 25 sessions, so that's a longer duration as well.
Okay.
Usually twice a week also. And they're there the same amount of time that they are for IV session. IV session, they're there for 2 hours. Spravato, they're there for 2 hours. Whereas oral, they can be at home or in your office if someone's driving them, and that's about an hour and a half.
In the IV sessions, like what are those 6 sessions? What's the frequency there?
2 to 3 times a week, so you're done within 2 or 3 weeks.
You're done with it.
Yeah.
And so the other thing to think about for clients in the right fit is also like, okay, you might not be able to, you can't go to your job that day, but you also might not be able to go to your job the next day, you know, or return to school, how does that look? And so having those conversations and problem solving, you know, some clients are like, I don't care, I'm missing work so much anyway, I'll take 2 weeks off, you know, and it's what it is.
And sometimes people would want to kind of do it all within the 2 weeks and then would very quickly be overwhelmed by that or would have some reaction to that and would have to kind of slow that down. The research is to have it done within 2 or 3 weeks. That doesn't mean that always happens that way because it's still client dependent, you know, and how their brain responds and how they do. And some people are okay at session 5 and they don't need that 6th session, and that's great. And other people need to go through a little bit longer of a series too. So there's definitely some variability, but in general, 6 sessions over 2 to 3 weeks. Yes.
Do you think it's important for therapists to have lived experience with ketamine to provide assistance?
I think it's helpful. It's not always possible either, but I think it's helpful.
Yeah.
I
Or
think,
psychedelics in general.
yeah,
So maybe not ketamine specifically, but just,
something.
yeah.
Yeah. It's helpful to know, to be able to explain what it might be like, because again, it's different for everybody, so you can't say exactly by any means, but you can have a better idea.
Yeah.
Yeah.
Because there's the coming in, so for a psychedelic experience, you're kind of coming in to the experience and then you come out of the experience. And so it's the coming in and coming out that can be really anxiety producing for folks. And so that's the place that you want to do like our great therapeutic skills of like grounding and like, you're okay, you know, let's take some deep breaths, like, you know, and it's interesting to see, you know, some people will, when they're going in, like they'll get the giggles, you know, or they'll get the giggle/cry. You know, they're like, what's going on? You're like, this is normal, just keep going, you know. So it's sometimes helpful to know what that going in and going out feels like.
That makes sense. Yeah. And just how vulnerable it can feel. Like you feel very open and very exposed. And so to know that like you can like cover your face if you don't want anybody looking at you. You can do some of these, you know, and like what do you want that to look like? What do you want that prep to be like? Because it can feel really vulnerable and like, oh my gosh, everyone can see me, everyone is looking at me, which isn't a great feeling for anyone. And so having some preparation that like that might happen, that's totally normal. It's gonna pass. Also, it's gonna last maybe like 2 minutes, then we're gonna be through that. But time also is weird when you're on psychedelics, so you don't know when it's 2 minutes. You think it's an eternity or nothing.
Right.
There's not, you know.
Time's illusion.
Yes. Time is not real. Yeah.
I had one client who, she listened to the same song over and over again for probably about an hour and a half. It was a great song. So like, I was like, oh, we can do this. But there was definitely a point where she was like, I can't have you look at me and I don't want you to see me. And I was like, that's fine. I mean, I can go over here, you know? And so like just knowing that with clients too.
And encouraging them to ask for
Yes.
those things. Like if they feel like they can find their voice for a minute and tell you what they need, like absolutely please do that. But it sometimes doesn't feel possible. And so normalizing that too. Like you might feel like you lose your voice for a little bit and that's okay.
Yeah.
We'll do our best, you know?
Yeah, any questions?
Yeah.
For folks who are interested in it, but maybe have some reservations or maybe some misconceptions, or like, how do you have conversations with folks who are considering it but are hesitant in a way where it still feels like very like empowering?
That's a great question. I think that giving people the facts can be really helpful and making it really like about their own choice about that. And kind of like, this is what the experience looks like, grounding them in like the tangible pieces of it, like this is kind of what this looks like, this is how it's helped other people. That can kind of help them move through that a little bit. Giving them resources too, but not too many. We also don't need all the resources, so they think that all their psychedelic experiences will be like microphone. Like, we don't need that, you know? But really, you know, I have some clients who I think are really wanting to do this, but they're not quite ready to do it, and we just know that it's there at some point, you know, to go into that when they're ready. We have some more nervous system stuff and regulation stuff that we have to do first.
I'll talk with people about why they're interested, like what their goal is, you know, like their intention, their goal in exploring that in the first place, and so we can explore if that's even the right avenue, you know, because sometimes we see things or read things or hear other people's experiences, and I think that, oh, well, I have to do that too, but maybe I don't want to. You don't have to. You don't have to do anything. You know, and so I think exploring that why of like what makes you curious about it, or what makes you hesitant about it, or what, you know, like what comes up for you around it, and just kind of exploring that stuff I think is helpful too.
It's kind of like EMDR. You know how you get other people calling like, I want to do EMDR, I was told to do it, and you get them in the office and you're like, no, I mean, we could, but like also we could do this over here instead, or we could do this over, you know. Sometimes that comes up where people are just like, oh, I heard that this is a cool thing and I should do it. And you're like, well, let's talk a little bit more about that in the back there a little bit.
Another question? Yeah.
Yeah.
Sorry.
You can go ahead.
I just wonder, do you have a prescriber in your office then that's prescribing, or are you working with other clinics in your area?
Working with other clinics, and when she's requiring, yeah.
I was gonna ask, do you typically refer your clients to the ketamine clinic, or do you get referrals? And then also, are you doing more Spravato or oral or IV? Can you just talk to that a little bit?
Yeah. So both. The referrals go both ways. In fairly even amounts for me personally. And then I don't have a lot of people doing Spravato because they've already come off an SSRI or don't want to go back on an SSRI, and that's the only way to get insurance to pay for it.
Got it.
I have a lot more who do IV.
Yeah.
And so I just refer to the clinic, and then the clinic refers people to me for integration.
So in the instance where they're paying out of pocket, what are the clinical requirements? I guess are they looser? I'm assuming that.
You pay out of pocket, yes, but they still have to have a diagnosis of OCD or depression, or you know.
The ketamine clinic will still diagnose them. They're still required to diagnose them to provide the service. So there are still pretty similar clinical guidelines in those terms. But you definitely have more flexibility in terms of frequency and things like that. Yeah.
I will also say age too. I had a couple minors clients, but they had to pay out of pocket. Yeah.
I had one more, if you don't mind.
Absolutely.
Telehealth only. It sounds like they can still do this.
Absolutely. Yeah.
Okay. That was a short question.
Yeah.
If you are a woman or identify as a woman, we are running an experiential retreat in January if anyone is interested. So there's this information here. Definitely for those who are, kind of interested in, having the experience themselves and figuring out what that looks like, and also, kind of doing some healing work for themselves. So we've got a good little setup going, and still have some spots available if anyone is interested.
It's going to be in Ann Arbor. It's in January, and I know folks who do not live in Michigan are like, oh my God, why are you having us come to Michigan in January? But like, we're not going outside. We're going to just like cocoon inside, have a moment, really do some deep healing, and January is a beautiful time for that. It's really about rest and restoration. So I really want to encourage you guys to do that. It's a great experience. And this is how we can help it now with you guys. If you have questions, we do, you probably see there's the Trip Hooray. We do the coursework, so we can help people with microdosing protocol, integration, just connecting with resources, where the ketamine clinics in my area, that type of stuff. So definitely feel free to reach out.
And then if anyone doesn't mind providing some feedback, it is helpful to us, and it's also how I can become a CE provider, because you have to submit this stuff to ASWB that you did feedback things. So if anyone wants to provide us feedback, I would really appreciate it. Thank you so much.
Thank you guys for coming.
Yeah, thank you.
Thank you.